Hi, and welcome viewers of Nursing Academy 101. In this video, we will talk about latest maternity-related multiple choice questions for nurses along with the answers and rationale part 2. But before we start, please don't forget to subscribe, like and share the channel to encourage us to continue and provide you with all new. Question number 1. A pregnant client at 36 weeks of gestation is experiencing sudden severe abdominal pain. The nurse suspects placental abruption. Which assessment findings support this suspicion? A. Uterine contractions every 10 minutes. B. Vaginal bleeding. C. Fetal movements felt by the client. D. Normal fetal heart rate. The answer is B. Vaginal bleeding. Placental abruption is characterized by the separation of the placenta from the uterine wall, leading to vaginal bleeding. Sudden severe abdominal pain may also be present. Uterine contractions every 10 minutes may indicate preterm labor but are not specific to placental abruption. Fetal movements felt by the client and a normal fetal heart rate do not rule out placental abruption. Question number 2. A postpartum client is diagnosed with mastitis. Which nursing intervention is most appropriate? A. Encouraging the client to continue breastfeeding. B. Applying cold compresses to the affected breast. C. Restricting fluid intake to reduce milk production. D. Initiating antibiotics as prescribed. The answer is D. Initiating antibiotics as prescribed. Mastitis is an infection of the breast tissue that requires antibiotic therapy. Initiating antibiotics is the most appropriate nursing intervention to address the underlying infection. Encouraging the client to continue breastfeeding helps with milk drainage and can help resolve mastitis. Applying more compresses, not cold, to the affected breast can promote comfort and milk flow. Fluid intake should be encouraged to maintain hydration and milk production. Question number 3. A pregnant client with gestational diabetes asks about the potential risk to the baby. The nurse should prioritize discussing which complication: A. Fetal macrosomia. B. Preterm birth. C. Neonatal jaundice. D. Respiratory distress syndrome. The answer is A. Fetal macrosomia. Gestational diabetes increases the risk of fetal macrosomia, excessive fetal growth, which can lead to complications during labor and birth. Preterm birth, neonatal jaundice, and respiratory distress syndrome can occur in infants of diabetic mother but are not directly associated with gestational diabetes. Question number 4. A pregnant client at 20 weeks of gestation has been diagnosed with placenta previa. Which instruction should the nurse provide? A. Avoid sexual intercourse. B. Increase physical activity. C. Perform vigorous exercises regularly. D. Use tampon for vaginal bleeding. The answer is A. Avoid sexual intercourse. Placenta previa is a condition in which the placenta partially or completely covers the cervix. To prevent trauma or potential bleeding, the client should avoid sexual intercourse, which can disrupt the placenta. Physical activity is important during pregnancy, but strenuous or vigorous exercises should be avoided. Tampons should not be used due to the risk of introducing infection. Question number 5. A client is receiving magnesium sulfate for severe preeclampsia. Which finding requires immediate intervention? A. Deep tender reflux of +2. B. Urine output of 20 mm per hour. C. Respiratory rate of 14 breaths per minute. D. Serum magnesium level of 9 mg per deciliter. The answer is B. Urine output of 20 ml per hour. Magnesium sulfate is a medication used to prevent seizures in clients with severe preeclampsia. One of the adverse effects is decreased urine output. A urine output of 20 ml per hour indicates inadequate kidney perfusion and requires immediate intervention, such as adjusting the medication dosage or discontinuing the infusion. Deep tender reflux of +2 a respiratory rate of 14 breaths per minute, and a serum magnesium level of 9 mg per deciliter are within normal range and don't require immediate intervention. Question number 6. A newborn is diagnosed with hyperbilirubinemia. Which intervention should the nurse prioritize? A. Initiating phototherapy. B. Administering intravenous fluid. C. Encouraging breastfeeding. D. Placing the newborn in an incubator. The answer is A. Initiating phototherapy. Hyperbilirubinemia in newborns can lead to jaundice, which can be managed with phototherapy. Phototherapy helps convert bilirubin into a water-soluble form that can be excreted by the body. Administering intravenous fluid may be necessary in severe cases, but it is not the initial priority. Encouraging breastfeeding and placing the newborn in an incubator can support neonatal care, but don't directly address the hyperbilirubinemia. Question number 7. A client at 38 weeks of gestation arrives at the labor and delivery unit with rupture of membranes and a prolapsed cord. What is the nurse's immediate action? A. Administer tocolytic medication. B. Prepare for an emergency cesarean section. C. Elevate the client's hip with a pillow. D. Place the client in a Trendelenburg position. The answer is C. Elevate the client's hip with a pillow. In the case of a prolapsed umbilical cord, the nurse's immediate action is to relieve pressure on the cord by elevating the client's hip with a pillow. This helps reduce compression of the cord and maintain blood flow to the baby. Administering tocolytic medication may be considered to delay labor temporarily, allowing time for interventions. Preparing for an emergency cesarean section is appropriate, but relieving pressure on the cord takes precedence. Placing the client in a Trendelenburg position can further worsen the situation and is contraindicated. Question number 8. A postpartum client who delivered vaginally is at risk for thrombus formation. Which nursing intervention is most important to prevent thrombophlebitis? A. Encouraging ambulation and leg exercise. B. Administering prophylactic antibiotic. C. Applying warm compresses to the leg. D. Restricting fluid intake. The answer is A. Encouraging ambulation and leg exercise. Encouraging ambulation and leg exercises is crucial in preventing the thrombophlebitis, formation of blood clot in veins. These activities promote blood circulation and prevent stasis, reducing the risk of clot formation. Prophylactic antibiotics are not directly related to thrombophlebitis prevention. Applying warm compresses can be helpful for localized discomfort but doesn't address the prevention of thrombophlebitis. Restricting fluid intake is not recommended, as hydration is important in preventing clot formation. Question number 9. A client who is 8 weeks pregnant reports nausea and vomiting throughout the day. Which nursing intervention is most appropriate? A. Advising the client to eat large meals at regular intervals. B. Recommending the use of ginger supplement. C. Suggesting the client avoid drinking fluids with meals. D. Encouraging the client to eat dry bland food. The answer is B. Recommending the use of ginger supplements. Nausea and vomiting, commonly known as morning sickness, are common in early pregnancy. Recommending the use of ginger supplement is an evidence-based intervention to alleviate these symptoms. Ginger has been shown to have antiemetic properties and can help reduce nausea and vomiting. Advising the client to eat large meals at regular intervals can worsen symptoms. Drinking fluids with meals and eating dry bland food may provide some relief, but ginger supplements are a more specific intervention. Question number 10. A client who is HIV positive is pregnant and receiving antiretroviral therapy. Which statement by the client indicates an understanding of the therapy? I can't stop taking my medication when the baby is born. B. I will take my medication as prescribed throughout the pregnancy. C. I should avoid breastfeeding to prevent transmitting the virus. D. ART will cure me of HIV and prevent transmission to my baby. The answer is B. I will take my medication as prescribed throughout the pregnancy. Antiretroviral therapy (ART) is recommended for pregnant clients with HIV to prevent mother-to-child transmission of the virus. The client should take the medication as prescribed throughout the pregnancy to reduce the viral load and minimize the risk to the baby. Stopping medication after the baby is born can lead to viral rebound and transmission. Breastfeeding is generally discouraged for HIV-positive mothers due to the risk of transmission through breast milk. Antiretroviral therapy doesn't cure HIV but significantly reduces the transmission risk. Question number 11. A newborn is suspected to have hypoglycemia. Which intervention should the nurse prioritize? A. Initiating kangaroo care. B. Administering a bottle of formula. C. Assessing blood glucose level. D. Placing the newborn in an incubator. The answer is C. Assessing blood glucose level. Hypoglycemia is a condition characterized by low blood glucose level. The nurse should prioritize assessing the newborn's blood glucose level to confirm the diagnosis. Based on the results, appropriate interventions can be implemented. Initiating kangaroo care, administering formula, or placing the newborn in an incubator may be necessary depending on the severity of hypoglycemia, but this intervention should follow accurate assessment. Question number 12. A client with gestational hypertension is receiving magnesium sulfate for seizure prophylaxis. Which finding requires immediate nursing intervention? A. Urine output of 30 ml per hour. B. Respiratory rate of 12 breaths per minute. C. Absent deep tendons reflex DTRs. D. Serum magnesium level of 4 mg per deciliter. The answer is C. Absent deep tendon reflex. Magnesium sulfate can cause muscle relaxation, leading to absent deep tendon reflexes (DTRs). However, if DTRs are completely absent, it may indicate magnesium toxicity and requires immediate intervention. The nurse should notify the healthcare provider, assess vital signs, and consider reducing or discontinuing the magnesium sulfate infusion. Urine output of 30 ml per hour, a respiratory rate of 12 breaths per minute, and a serum magnesium level of 4 mg per deciliter are within acceptable range and don't warrant immediate intervention. Question number 13. A client who had a cesarean section is experiencing postoperative pain. Which medication should the nurse anticipate administering? A. Morphine sulfate. B. Ibuprofen Advil. C. Oxytocin pitocin. D. Promethazine Phenergan. The answer is A. Morphine sulfate. Morphine sulfate is a potent opioid analgesic commonly used for postoperative pain management. It provides effective pain relief for clients who have undergone a cesarean section. Ibuprofen is a non-steroid anti-inflammatory drug that can be used for mild to moderate pain, but it may not be sufficient for postoperative pain after a cesarean section. Oxytocin is used to stimulate uterine contraction or control postpartum bleeding. Promethazine is an antihistamine commonly used for nausea and sedation, but it's not the primary choice for postoperative pain relief. Question number 14. A newborn is diagnosed with a cleft lip and palate. Which nurse intervention is most important in the immediate postoperative period? A. Encouraging breastfeeding. B. Placing the newborn in a supine position. C. Administering pain medication as prescribed. D. Provide small frequent feeding. The answer is B. Placing the newborn in a supine position. Placing the newborn in a supine position after cleft lip and palate repair helps maintain the integrity of the surgical site and prevent trauma. This position minimizes pressure on the suture line and facilitates healing. Breastfeeding may be challenging immediately after surgery, and alternative feeding methods may be necessary. Pain medication should be administered as prescribed, but proper positioning is the priority. Providing small frequent feeding is appropriate, but it is not the most important intervention in the immediate postoperative period. Question number 15. A pregnant client is diagnosed with iron deficiency anemia. Which dietary recommendation should the nurse provide? A. Increase intake of red meat and leafy greens. B. Limit consumption of dairy products. C. Avoid foods high in vitamin C. D. Decrease intake of whole grains and legumes. The answer is A. Increase intake of red meat and leafy greens. Red meat and leafy greens are excellent sources of iron, which can help improve iron levels in clients with iron deficiency anemia. Dairy products don't significantly contribute to iron intake, but they should not be restricted unless the client has a specific intolerance or allergy. Food high in vitamin C, such as citrus fruits and tomatoes, should be encouraged as vitamin C enhances iron absorption. Whole grains and legumes are good sources of dairy, fiber, and other nutrients and don't need to be restricted. Question number 16. A newborn is born at 37 weeks of gestation and exhibits nasal flaring, grunting, and intercostal retractions. Which condition should the nurse suspect? A. Respiratory distress syndrome (RDS). B. Transient tachypnea of the newborn (TTN). C. Meconium aspiration syndrome (MAS). D. Pneumonia. The answer is A. Respiratory distress syndrome (RDS). The signs and symptoms described, nasal flaring, grunting, and intercostal retractions, are indicative of respiratory distress syndrome (RDS) in a newborn. RDS occurs due to inadequate surfactant production in a preterm infant, leading to compromised lung function and respiratory distress. Transient tachypnea of the newborn (TTN) is characterized by rapid breathing shortly after birth and typically resolves within 48-72 hours. Meconium aspiration syndrome results from the aspiration of meconium-stained amniotic fluids and presents with respiratory distress, but it is usually accompanied by a history of meconium-stained fluid. Pneumonia can cause respiratory distress, but a specific history or diagnostic confirmation would be needed for this diagnosis. Question number 17. A pregnant client at 28 weeks of gestation is read negative. The client partner is read positive. What intervention should the nurse anticipate? A. Administering raised immunoglobulin program. B. Initiating antiretroviral therapy (ART). C. Scheduling a cesarean section. D. Preparing for a blood transfusion. The answer is A. Administering raised immunoglobulin program. Raised negative mothers who are carrying rhesus positive fetuses are at risk for sensitization to rhesus antigen. To prevent sensitization, the nurse should anticipate administering raised immunoglobulin program to the rhesus negative mother at 28 weeks of gestation and within 72 hours after birth if the newborn is rhesus positive. Antiretroviral therapy is used for the treatment of HIV, not rhesus incompatibility. Cesarean section or blood transfusion would not be the primary intervention for rhesus incompatibility. Question number 18. A pregnant client at 38 weeks of gestation presents with painless vaginal bleeding. Which condition should the nurse suspect? A. Placenta previa. B. Placenta abruption. C. Uterine rupture. D. Cervical polyp. The answer is A. Placenta previa. Painless vaginal bleeding in the third trimester is a common symptom of placenta previa, which occur when the placenta partially or completely covers the cervix. Placenta abruption typically present with sudden severe abdominal pain along with vaginal bleeding. Uterine rupture is characterized by severe sharp abdominal pain and fetal distress. Cervical polyps may cause intermittent vaginal bleeding but are not typically associated with painless bleeding in the third trimester. Question number 19. A newborn is diagnosed with a ventricular septal defect (VSD). Which assessment finding should the nurse expect? A. Cyanosis. B. Murmur. C. Bradycardia. D. Hyperreflexia. The answer is B. Murmur. A ventricular septal defect (VSD) is a common congenital heart defect characterized by an opening in the septum between the ventricles. The presence of a VSD often results in a murmur, which can be ausculted on cardiac examination. Cyanosis may be present if the VSD is severe and cause significant shunting of deoxygenated blood. Bradycardia and hyperreflexia are not directly associated with VSD. Question number 20. A client who is 32 weeks pregnant is admitted with a diagnosis of gestational diabetes. Which statement by the client indicates a need for further education? A. I will monitor my blood glucose level regularly. B. I should limit my intake of carbohydrates. C. I will need to take insulin to manage my blood sugar. D. Gestational diabetes will resolve after I give birth. The answer is D. Gestational diabetes will resolve after I give birth. Gestational diabetes is a type of diabetes that occurs during pregnancy and typically resolves after delivery. However, it's important to educate the client that having gestational diabetes increases the risk of developing type 2 diabetes later in life. Therefore, regular monitoring of blood glucose level, dietary modification including limiting carbohydrate intake, and possibly insulin therapy may be necessary. The client should be aware of the long-term implications and the importance of ongoing diabetes management and follow-up. Question number 21. A pregnant client at 36 weeks of gestation presents to the clinic with severe edema in the lower extremities, facial puffiness, and elevated blood pressure. The nurse suspects the client may be experiencing which condition? A. Gestational diabetes. B. Placental abruption. C. Gestational hypertension. D. Hyperemesis gravidarum. The answer is C. Gestational hypertension. The symptoms described, including severe edema, facial puffiness, and elevated blood pressure, are indicative of gestational hypertension, pregnancy-induced hypertension. This condition is characterized by elevated blood pressure after 20 weeks of gestation and can lead to complications such as preeclampsia. Gestational diabetes is characterized by high blood glucose level during pregnancy. Placenta abruption is characterized by sudden painful vaginal bleeding. Hyperemesis gravidarum is severe and persistent nausea and vomiting during pregnancy. Question number 22. A newborn is diagnosed with a congenital heart defect and is prescribed digoxin. What nursing intervention is essential when administering digoxin to the newborn? A. Administering the medication on an empty stomach. B. Monitoring the newborn's heart rate before administration. C. Assessing the newborn's blood pressure after administration. D. Administering the medication with a full glass of water. The answer is B. Monitoring the newborn's heart rate before administration. Digoxin is a medication commonly prescribed for newborn with congenital heart defect. Before administering digoxin, it's essential to assess the newborn's heart rate. Digoxin can cause bradycardia, so the nurse should hold the medication and notify the healthcare provider if the newborn's heart rate is below the prescribed range. Administering the medication on an empty stomach is not necessary. Assessing blood pressure after administration is not a specific requirement for digoxin. Administering the medication with a full glass of water is not necessary for a newborn. Question number 23. A client in active labor is experiencing severe back pain. What position should the nurse encourage the client to assume to relieve the pain? A. Supine position. B. Side-lying position. C. Hands and knees position. D. Semi-Fowler's position. The answer is C. Hands and knees position. The hands and knees position, also known as the all fours position, can help relieve back pain during labor. This position allows for the relaxation of the back muscles and promotes optimal fetal position. The supine position can exacerbate back pain and decrease blood flow to the fetus. The side-lying position and semi-Fowler position may not provide as much relief for back pain as the hands and knees position. Question number 24. A breastfeeding client reports experiencing sore nipples. What nursing intervention is most appropriate to alleviate nipple soreness? A. Encouraging the use of a nipple shield. B. Applying lanolin cream after each feeding. C. Suggesting formula supplementation. D. Advising the client to decrease breastfeeding frequency. The answer is B. Applying lanolin cream after each feeding. Applying lanolin cream after each feeding can help alleviate nipple soreness and provide moisturization and protection of the nipples. Nipple shield may be used in specific cases but should not be the first-line intervention for nipple soreness. Formula supplementation is not indicated unless there are specific concerns about infant nutrition or growth. Decreasing breastfeeding frequency can lead to engorgement and decreased milk supply. Question number 25. A newborn is diagnosed with spina bifida. Which intervention should the nurse prioritize in the care of the newborn? A. Administering folic acid supplement. B. Providing skincare and protection for the exposed spinal defect. C. Administering antibiotics prophylactically. D. Monitoring blood glucose level. The answer is B. Providing skincare and protection for the exposed spinal defect. Spina bifida is a neural tube defect characterized by an incomplete closure of the spinal column. The nurse should prioritize providing skincare and protection for the exposed spinal defect to prevent infection and further damage. Administering folic acid supplementation is important during pregnancy to prevent neural tube defect but is not the priority once the newborn is diagnosed. Antibiotics may be prescribed if there is an infection but are not routinely administered prophylactically. Monitoring blood glucose level is not directly related to spina bifida. Question number 26. A client who is 30 weeks pregnant presents to the labor and delivery unit with vaginal bleeding. On examination, the cervix is closed and the placenta is partially covering the cervix os. What is the most likely diagnosis? A. Placenta abruption. B. Placenta previa. C. Vasa previa. D. Cervical insufficiency. The answer is B. Placenta previa. Placenta previa occurs when the placenta partially or completely covers the cervical os. It's characterized by painless vaginal bleeding in the third trimester. On examination, the cervix is closed. Placental abruption involves the premature separation of a normally implanted placenta, leading to painful vaginal bleeding. Vasa previa is a condition where fetal blood vessels cross or run near the internal cervical os. Cervical insufficiency is the inability of the cervix to maintain a pregnancy and is typically associated with recurrent mild trimester pregnancy loss or preterm birth. Question number 27. A pregnant client at 28 weeks of gestation is diagnosed with gestational diabetes. Which intervention should the nurse include in the client's plan of care? A. Encouraging high protein, low carbohydrate diet. B. Monitoring blood glucose levels 4 times daily. C. Administering insulin as a regular dose before meals. D. Limiting physical activity to prevent hypoglycemia. The answer is B. Monitoring blood glucose levels 4 times daily. For a client diagnosed with gestational diabetes, monitoring blood glucose levels 4 times daily is an important intervention to assess glycemic control and determine the effectiveness of the treatment plan. The diet for gestational diabetes generally includes a balanced intake of carbohydrates, proteins, and fats with appropriate portion size and timing. Insulin therapy may be required in some cases, but the specific administration regimen should be determined by the healthcare provider. Physical activity is encouraged as it helps regulate blood glucose levels and improve insulin sensitivity.